According to the latest from China's National Health Commission, the death toll from the novel coronavirus outbreak has exceeded 500, which already surpasses the number of Chinese victims of the 2003 SARS epidemic. While the number of people infected continues to surge, those who have recovered is also on the rise, which suggests that some treatment may be working. But moving forward, how worried should we be? And when will the virus reach its peak? And what measures should China take and the world implement to contain the outbreak? To discuss these issues and much more, I'm happy to be joined by Professor Xue Lan, the Dean of Schwarzman College at Tsinghua University, and from Hong Kong by James Chow, a World Health Organization Goodwill Ambassador and a host of China Current. From Washington by Deborah H. Freeman, the U.S. Intelligence Director for the Executive Intelligence Review magazine, and from Singapore by Professor Wang Linfa, Director of Duke National University of Singapore Emerging Infectious Diseases Program. That is our topic. This is Dialogue. I'm Zhou Yuan. So let me start with you, James. According to a latest Hong Kong University modeling survey, it says the outbreak will peak in late April, probably early May. Well, there are different modeling saying different things. What is your opinion of their result?
I think we let the epidemiologists do their job, and I think that study may have come from the team led by Professor Gabriel Leung, who's the Dean of the Medical Faculty at Hong Kong University. He's usually very, very precise and not given to overstating or understating a particular trend. And they've really been at the heart of it, sitting with the chief executive at the press conferences and really communicating public health, breaking down the science, making very complex ideas understandable to a mainstream audience that is really hungering for information at this time. But I think if we look at the trends outside of that, we're still very much in the early weeks of this outbreak. We're still relying on the data to come in, and from that we can start building the patterns. But I think when you look at the whole picture, if the peak comes, and obviously, and I think in some ways people are looking towards a peak, not because of the large volume of numbers, but because after that it would suggest that the numbers will begin to tail off, both in terms of newly infected, but also in terms, of course, of the fatalities.
But we still see increasing numbers of infection cases here in China. There was another modeling, according to the Director General of China's Center for Disease Control, Gao Fu, saying that the turning point could come on Lantern Festival, which is February the 8th. I think partly because China imposed stringent lockdown and travel limitation on people. Do you think that is a reasonable estimate?
Well, I was speaking to some of the political leaders who were helping to lead the SARS response 17, 18 years ago. And what they were saying was that at some point, the turnaround in this outbreak will occur. Not all of a sudden, not by chance, but because a number of measures that have fallen into place already will start clicking and will start really beginning to take effect. So, as you said over there, we've had the Chinese New Year. For many people, that was extended. You had a lockdown of a number of cities that involved well over 50 million people. And at the same time, we've got better health screening, we've got better diagnostics, and all this coming together, and plus the work from home arrangement, which is taking place not only in the mainland, but right here in Hong Kong. All those measures together will begin to produce a combined effect. And that probably is the reason why, as he said, why Dr. Gao came up with a very, very different pattern compared to what we're getting in Hong Kong.
And another thing is that this came at a very special time. That's the Chinese annual Lunar New Year holiday. And some people say we were lucky because people stay at home during holidays. Other people say we were unlucky because people travel en masse to different places. What is your take on this?
I'll say the latter if I had to pick between the two. because the speed and the mass is what's caused this problem. The speed of traveling to your own home cities, but the sheer weight and volume of the numbers who are on the roads, on trains and buses. You know, whenever you introduce movement into an outbreak or even to a disease epidemic, you're really introducing the transfer and the opportunity to move. So in that sense, you know, when we spoke to Dr. Margaret Chan a couple of days ago, she also highlighted that this mass and speed were the two factors that really accelerated the speed of this already fast-moving virus. But at the same time, what we now see is a very structured return to work. As we said, people being told to stay in their hometowns for a bit longer, or those who have already returned to stay at home indoors. So I think what the government is trying to do is to ensure wherever you are, we're going to make this a very structured process so we don't get a sudden surge or extreme pressure on the major cities where most people live and work today.
And Professor Xue, I want your evaluation on China's response, the draconian intervention, the lockdown of 11 million people metropolis, and the minimum travel all over China. Do you think all these policies in the terms of public administration are working in terms of facing an epidemic like this?
I think absolutely. I think that this measure that's taken by the government has really, I think, as our Hong Kong colleagues have already said, the mobility of people is probably the best cases for the virus to transfer. I think by taking these sort of measures, I think it's really effectively slowing down or reducing dramatically of the flow of people, and that actually would certainly have a great impact on the spread of the virus.
But already a lot of people worry about how long this draconian policies will stay on, because people cannot stay at home forever. They need to go back to work. They need to travel and work with others. What do you think of the cost of keeping those policies in place?
I think you're absolutely right. I think actually the economic cost due to this, these measures are dramatically high, given the size of the Chinese economy. But at the same time, I think at this time, I think this is probably the best measure. But of course, I think the next stage, what we need to do is to have a more sort of measured, process to see, in what places, in what kind of spread we're looking at, and then see how we can have a more precise, policy measures to respond to the virus situation. I think we are still at the very early stage of this, epidemic, and so we're still trying to understand what is the characteristics of the virus and how it's spread, and how actually we can best to prevent its spreading.
And also, there are special hospitals being built up because of this. They actually were built in a matter of weeks in Wuhan to cope with a surging demand for medical care. Why can China manage to do that, and to what extent it helps to alleviate the demand of medical resources? Professor Xue?
I think this is sort of partially sort of based on the China's experience in sort of dealing with the SARS. I think during the SARS period, China actually built a large hospital in Xiaotangshan that helped to address the problem. Now, this is really sort of experience from that episode. I think this building such large hospital, I think there are multiple effects. The first is that you can really get the more severe patients to be in one location, and also to bring your best doctors to treat them. I think also, given that the facility is very well designed and made sure that they were safe, and so that can reduce the further the potential risks to the doctors. So I think that's actually probably going to relieve a lot of the stress that's being felt by many hospitals in Wuhan city, and that would allow them to to accept more patients, which is actually now what's really needed.
And Deborah, are you online? I want your take on this in terms of the Chinese government's response after the outbreak of the novel coronavirus and the huge demand for medical care in the epicenter in Wuhan.
I think that you cannot argue with the fact that the response by the Chinese government has been absolutely heroic. They have done everything that any public health expert could desire. To my mind, the problem is not in the way the Chinese government has responded, but is much more in the way that my own government has responded, which is something that I can say as a public health professional and as my colleagues all over the country agree, is we are not expending our energies in a useful way. We're wasting resources on travel bans and things like that, when in fact America's energies are better spent following China's example and restoring our public health infrastructure, for instance.
And that,
rather than imposing travel
bans. That is a very
bans.
relevant question, is about the international cooperations. So far, the infection cases, most of them are in China. Elsewhere, there are several hundreds. Why there is a gap of number of cases? Some say because China's stringent and extraordinary measures. Do you agree?
No, I'll tell you. I think the problem is that because of the way China has been penalized for reporting cases, that you have many other governments that don't have as robust a healthcare system who have no idea. They're not capable of the kind of surveillance that China imposes, and that is a real problem. I think it's one of the reasons why the World Health Organization has absolutely urged that the travel bans be ended. It's not the right way to contain this. Isolation and exacerbating what is a real emergency in China is a wrong-headed and from my standpoint, it's an immoral approach. I think we need a much better mechanism for international testing, because if you look at the rate at which the disease is accelerating, even given the extraordinary measures China has taken, my fear is that there are many cases outside of China that have not been detected. And I think a policy of isolation makes that worse. It's bad for the United States, and it's bad for the world. This is an area where you need absolute international cooperation. And I just don't think China's really getting everything it needs.
And Professor Xue, what is your take on international cooperation? A lot of countries have imposed travel bans to and from China, but the WHO actually advised against it.
Well, I think that certainly, I think I couldn't agree with my colleague Deborah in Washington, D.C. more. I think that, of course, you know, it's understandable there's always some sort of overreaction. But I think the critical fact is that for any sort of outbreak such as this one, it's really, indeed, I think in today's world, it's an international. I think the collaboration and the coordination among different countries is really critical in addressing this issue. I think this time that Chinese scientists have already shared their research findings globally, I think, which I think provided great help for the international colleagues to find ways to respond to this. And I think also in terms of really how to share the experience in treating the patients and in many other aspects, I think actually there should be more collaboration and coordination rather than isolation.
And about China's response, I want to ask you this, because the Chinese the Center for Disease Control and Prevention actually have an automated early warning systems for infectious diseases. But do you think this time it actually worked? Because a lot of people complain that we haven't been able to put in place more stringent policies earlier than we should.
Well, I think there are two things here. That one is that, of course, we first, whenever we were dealing with this kind of a new sort of novel virus situation, there's always, I think, that a dilemma you're facing. On the one hand, you don't want to have the false alarm that really generates panic and then, make the general public, unnecessarily, sort of worried and so on. But it turned out it's not it's not a problem. On the other hand, also, you're also worried that if indeed, such as this one, that you're not really giving enough warning, so that actually that made the virus spread. So I think that's the kind of a dilemma that people in public health, they are always facing. I think, of course, for this time, we need to know more details about, how, at what time they are making that judgment and whether it's too late or too early. But of course, certainly, we'd like to see, the warning, if it could have come earlier.
So you are saying this is a difficult trade-off because the local Medicare authorities actually knew this could be human-to-human transmission before January the 20th, but they have withheld the information, and you are saying this is a very hard call.
I'm not saying that because I think that, because I think a lot of people are referring to that because of the research paper that was published in New England Journal of Medicine. My guess is that we need to look into more details and to, to get the people who were the authors of that paper to respond. But partly, I think, maybe some of those, sort of cases of so-called doctor-to-doctor transfer, was probably in those data was really reconstructed retrospectively, rather than at the moment, at the time, that was, a known fact. So we need to sort out those issues before we can soon make a judgment.
And James, I want to ask you about the treatment and protection issues. It seems that the National Health Commission already confirmed this is a human-to-human transmission, especially via droplets. So what is the best way to prevent it from being further spread?
I mean, WHO, and it's not just WHO, there are many other sources. You've got US CDC, you've got Chinese CDC as well. They've made it very clear that, good and great hand hygiene is very important, and also the use of masks, but not just wearing masks, but wearing it properly, disposing of it after a single use. And there's been plenty of information of that online. But at the same time, in terms of the therapies, because we know of new drugs being tested in China at this moment, we've also heard of therapies that were used during the Ebola outbreak being applied to a confirmed case over in Washington State in the US, and also some therapies that are traditionally used in antiretrovirals for HIV and AIDS. I think more than any of that, because WHO has said there's no confirmed therapeutic that is confirmed to work at this time. What's more important to think about is in terms of innovation and the space for science, and as Dr. Friedman said over there, that space and opportunity now for international collaboration. We can't see this disease as belonging to China, even though it may be able to be traced back to it. It has to be seen as a humanitarian effort and a scientific effort to push it forward. So what you may have in terms of the antiretrovirals or the Ebola therapies is an innovation on what we've already used and what we've already applied before, and to innovate that for this particular virus. People have already started isolating the virus in the laboratories to try and better understand it. Of course, that opportunity was opened up when China shared the genetic sequencing at the end of December. But this whole point and this whole vision is laid out by the WHO in terms of its public health emergency of international concern, because that provides the framework for people to collaborate on expertise and capacities internationally. Although Dr. Tedros has said that the existing binary system of do you declare an emergency or don't you declare an emergency may be outdated for a world which is nuanced and a world where diseases move faster than man.
And Deborah, what is your take on the treatment? Because we have heard that the remdesivir that is developed by Gilead Company in America have been put into clinical use already in Wuhan to treat some patients. They were told to have some antiviral effects. Do you think it is the right approach, because it hasn't passed the clinical tests of the FDA?
Well, I think that what we're faced with right now is that we're dealing with a virus that we don't know everything about. If you look at the sequence of events in China, it may very well be the case that the virus itself is changing. And under those circumstances, and we have to recognize that whatever we do know about this virus is due to information that's been contributed by China. Which, to my mind, means that international engagement and collaboration is the single most important thing that we can do in response to this virus. And you know, that kind of collaboration is the natural impulse of scientists. And there should not be any constraint placed on that. I know that there are many labs in the U.S. And in Russia who believe that they are making important breakthroughs. But
Professor Wang, I also want your take on this. Professor Wang Linfa, director of the Nuuk National University of Singapore Emergent Infectious Diseases Program. Do you think the clinical trial already going on in Wuhan of remdesivir is a right response?
Oh, I think it's the best maybe you can offer right now, right?
And I know that you've been doing research on the source of this novel coronavirus. Some Chinese researchers found similar strains in bats, 90% of similar in terms of genetic information. What is your assessment of the source of this new strain?
Actually, the closest is 96% identical to this novel coronavirus from humans. So I just want to rewind back, 17 years ago, I led a team, including Chinese scientists. We first discussed a virus in bat, which is 90% identical to the SARS coronavirus. And it took us another 10 years. Finally, we found a virus which is 98, 99% identical to SARS. So I think to get a 96% identical virus from bats to this novel coronavirus itself is a tremendous achievement. Of course, in science is that unless you have 100% certain evidence, you will never say that's it, right? So, but for somebody who have been studying the bat-borne virus for the last 20-something years, I will put my sort of confidence to say eventually we will prove that this most likely is also a virus originating from bat.
But how did this spillover happen? Is it just the bat transmitted the virus to humans, or there was a intermediate animal?
Yeah, so in the last 25 years, I have personally investigated 6 different emerging viruses from bats. Most of them will not transmit the virus from bat to human. They need an intermediate host. So for civets, that's for SARS virus, that's a civet. Okay, for the MERS virus, that's camel. So we call this animal X. In the current investigation, this animal is still X. We don't know. So, but I personally feel like there's high chance there's another animal that got the virus and amplified before they transmit to human, rather than a direct back-to-human transmission, because this is a very, very rare event.
Does that mean that we have a better understanding of the source, that we will have more tools and approaches to deal with the new strain of virus?
Not for the current outbreak, because the virus, I think the #1 priority is control the human-to-human transmission. But to prevent future outbreaks, for example, the civets farming, and the civets trading, was banned in Guangdong province after the SARS coronavirus, and we think that helped to control future outbreak. And then in Singapore, we had another virus, in Malaysia, we had another virus called the Nipah virus, and we knew it's a bat, to pig to human transmission. So once the Malaysian government separates the bats from the pig farming, and that turned out to be very effective. So yes, it's very important to identify that animal X for the current coronavirus, for future outbreak prevention, but for the current outbreak now, the number one is control human-to-human transmission.
And 17 years ago, it took the whole world roughly 6 months until the SARS epidemic wind down. Do you think if this is similar, because it shares 80% of the genetic information with SARS, is it similar in terms of how we deal with it and how long we're going to fight this?
Certainly, the way we deal with it is the same, quarantine. Quarantine is the most effective before we have a vaccine. If we have a vaccine, of course, vaccine it will be more effective to do ring vaccination. So currently, I think quarantine is the most effective methodology, just like we use that to control SARS. But in terms of the timing, actually for SARS, it was more than 7 months from the first appearance of the atypical pneumonia to a total declaration by the WHO to say the transmission is over, so more than 7 months. We are now 2 months into it. I think that so far, I think it looks like it will be similar. It takes another few months if we're lucky to control that outbreak.
I want your take on Chinese healthcare system. Now, Wuhan is practicing a triage system that is they first test the suspicious patients in those quarantine centers, and then they move them into gymnasium-turned makeshift hospitals, and then move into special hospitals. Is that triage system the best way to deal with an epidemic like this?
I'm sorry that I'm a virologist, actually. I study viruses. I'm not public health control person, so I think I will not be qualified to comment what's the best control measure in that context.
And James, you have anything to say on this?
I think what I will leave you with is exactly going back to the question you asked before. Even though it may share the majority of the genetic information, China is not the same as it was 18 years ago. It's a country that continues to transform. It's become very, very strong in science and technology and innovation. It's opened itself up to the world. I think it's learned from its lessons that came with SARS. Those were painful lessons. These are painful lessons again this time. But as we hear now, we don't know everything we know about this disease, and that's not necessarily a reflection on the heart or the willingness of a country to want to try and rectify this. I don't think any government wants their own people to suffer, and certainly not at the hands of nature. Sometimes nature is just more powerful than man. And I would also add one thing: be very careful about these travel restrictions. Health and science should be the two areas of mankind that are sacred and immune from politics.
And Deborah, those Wuhan doctors, they're short-staffed and challenging on morale. What would you say to them?
What I would say to them is that the heart and soul of the entire world is with them. But what I would say further is that if, in fact, we are going to succeed in containing and coming out of this crisis, that physicians in China are entitled to help from outside. You know, in natural disasters, the entire world immediately goes on major drives to offer assistance. I don't see that happening here. And I think that really this is critical. I don't think the rate of infection has peaked, and I think that we are going to see this outside of China.
All right. International cooperation is what we look forward to. Thank you very much, Deborah, James, and also Dr. Wang. You've been watching Dialogue here on CGTN. I'm Zhou in Beijing. Thanks so much for watching. Goodbye.